the Minister of Health, Joe Phaahla, conducted a site visit and led the official reopening of the Accident and Emergency Unit at the Maxeke, Johannesburg Academic Hospital. This is in line with the undertaking made in March this year that the crucial unit of this facility will be ready by the end of April 2022 as part of the phased-in approach to rehabilitate the hospital.
So in terms of the remaining work, the engineering team from National Department working with the Provincial Department of Health and also with the DBSA conducted a block-by-block assessment for the entire institution, and they have developed a detailed project plan covering the milestones. So all the work of the rehabilitation, we hope everything goes according to plan, will be completed by December next year. So at the current moment, there will be no walk-in patients into the accident and emergency. It will only be, for now, arranged transfer of patients.
The ward's CT machine is also still being repaired, meaning the hospital is not yet ready to take in patients seeking emergency treatment. The hospital has made advancements to the general safety of the hospital and advancements in the safety in case of emergency.
Acute strokes, some of the trauma like stabs, gunshots, also with head injuries, all those require a CT scan. So you can't risk to bring in fresh patients from the accident scene, for instance, when you don't have a CT scan. So once we are quite optimistic that by the end of the week it will have been fixed. There might still be the recalibration and other aspects which need to be done, but once that is done, then the full the scan will be fully functional, then they'll be able to take trauma patients.
So if you remember, Akere, the main thing was that we needed to have an increase in terms of being able to contain the heat, so that if there's a fire here, it does not easily spread to the other side. And as it was told on the other briefing, there's been extra walls that we don't recognize here that have been built behind, and that's one of the areas of reinforcing. Also above each unit, they've inserted new slabs as well, so that they heat from this area. If you look at specially fabricated slabs, so that if there's a heat here, you can contain it as long as possible before you affect the other floors, plus the smoke management as well. So it's not just about the heat, it's also the smoke, all of them speaking about better safety in terms of the quality and the ability to react if there's an event that we had like last year.
So it also looks at the fire rating that we have. So all of the doors, the walls, everything has to have a particular fire rating in accordance to the COJ regulations that's there. That allows us, because of the type of patients that we have, some ambulatory and some that would be bedbound, sufficient time in order to move them out of areas of danger. All of our staff within Charlotte were working within this area of A&E. Before we can decommission any area, all the staff have to be trained on how the new fire systems work, how the evacuation routes work coming in or going out of different areas in the hospital.